is Carrie Johnson, and I work at the Maitland Valley Family Health Team in Godrich here, and I'm a nurse practitioner in the primary health care field. What I do as a nurse practitioner is that I treat or see people and assess people for their health concerns right from infancy to 100 years old, you could say. I do anything from well baby visits, immunizations with those well baby visits, acute care illnesses such as like sore throats, sore ears, chest infections. I do well women exams, well male exams. So that's your annual health exams that I would do for those. And then I also deal with chronic diseases as well. So diabetes, high blood pressure, cardiovascular, and so forth. I think personal qualities that you would need is somebody that would be a very good listener. So being able to listen to your patients, their concerns, having patience, sometimes dealing with individuals that it can be slow to walk or with mobility. You have to have patience for them to be able to walk into the exam room. Sometimes dealing with children that can be a little fussy. You need to have patience with that as well. I think those are some of the characteristics that somebody needs within this field, as well as somebody that is able to communicate well with others. I think somebody that understands the whole body as a whole. So just that it's not a physical, but it's also spiritual, and there's a mental aspect and everything. So it's being able to look at somebody in a holistic viewpoint opposed to just looking at somebody physically. And then as far as physical aspects, I don't think there's really any physical aspects you really need for the job, except for I think you need to be healthy, because you are a prime example to your patients. So I think living a healthy lifestyle, it can be an asset for sure to that. So as far as advice goes, depending on what stream of primary healthcare you want to go into, or nurse practitioner stream, if you wanted to be in primary care, I would definitely advise anybody to go into emerge experience. Having an emerge background and working in the emergency department definitely assess or allows you to have quick abilities to assess people quickly, and also to deal with any emergency sakes if you have to, and as well as it gives you a broader aspect of looking at all healthcare needs, having that emerge background. Coming from a city setting, which is where I did all my nursing, I think having a rural setting in nursing background is also another asset as well, because I find sometimes working with my rural counterparts at our clinic, they are a little bit more advanced in doing their ECGs and things like that, which is not necessarily something that I had actually gotten in my nursing career. So that's one thing that I would definitely, so kind of like a rural nursing experience, and then also emerge experience. That would probably be the two big key things in the nurse practitioner role for sure. My most enjoyable aspects of the job would be probably dealing with the babies. I love doing the well baby visits and seeing the newborn babies. So I can assess a baby within days old from discharge from hospital and right up until they're into preschool. So I do, even though the toddlers can be a little challenging at times, I still don't mind dealing with those. I honestly don't mind dealing with any age, but probably babies are the things that I look forward to the most. The other things I really enjoy about my job is when I make a difference in somebody's life. Even it's a teenager or a young adult or an elderly person, as long as I can make a difference in their life, I think that's what I enjoy the best about my job. And it allows them to become healthier and making wiser decisions or whatever the case is. I sometimes will cringe at those challenging individuals, but sometimes those challenging individuals blossom into something quite beautiful, and I do enjoy seeing that journey that we often go through together as a healthcare provider and as a patient as well. The thing I hate, or I guess I dislike the least, I should say, is probably giving a person a bad diagnosis. And that's probably the thing that I carry the most heavy upon my heart, and having to deal with that. Um, and that's probably the only thing that I really don't like about my job. So from high school, I went directly to Bible College in Peterborough, which is the Eastern Pentecostal Bible College. The third year of my Bible college, I was able to do an exchange program where I lived in Africa for a year. When I was in Africa, I actually lived a month in the Rift Valley with a missionary nurse. And that's really where my love for nursing started, was actually there. We did a clinic, which was a Well Baby, Well Mom clinic, where we weighed babies on the weigh scales. And these moms had traveled for days to get to this clinic just so that they could get like a little package of vitamins so that they could feed all of their kids. And I thought, this is what I want to do to make a difference, basically in the world, and like not even just here, but also globally. So when I graduated from Bible college, I looked into various universities and colleges where I could go. And because we lived in London and right across from Fanshawe College, I actually applied at Fanshawe College, so I wouldn't have to move anywhere. I got accepted there, but I was unable to start till the next year. So I really prayed about it. And I said, God, if you want me to do this, you're going to make a way. So I got a call within a day that I was actually accepted, that I could start early if I wanted to. So I started right on time. Within the first week of the nursing class, there was a nurse practitioner who came and spoke to us in that class and talked about advancements in nursing. And at that time, nurse practitioners were on the horizon, but they weren't, there wasn't a lot of them. There was maybe only 30 in Ontario at that point. And so I listened to the presentation and I thought, that's what I want to do. So from there, I did my 3 years of Fanshawe College, graduated with a diploma. I went into nursing at the London Health Science Centre and worked on the orthopedic floor for about 2 or 3 years, getting experience. And then at that point, I transferred to the Emerge department. Worked about 7 years in the Emerge department and decided this is the time to go back to school. So I applied at Western University of Ontario in London and got accepted there to do an upgrade from a diploma nurse to a Bachelor of Science in Nursing. So I did an upgrade that took me 1 year to do, and at the beginning of that year, I actually applied for the nurse practitioner program. I got accepted into the program and rolled right into the nurse practitioner program from doing that. So I did another 3 years at the university level. Graduated in 2006 with a certificate of a nurse practitioner in primary health care, which means that I'm only certified to do primary health care nurse practitioner. Since then, there has been several streams of nurse practitioners that have started. So with going to university, you can actually go into any stream now. There's a pediatric stream as well as an anesthesiologist stream, I believe, and then also an acute care nurse practitioner along with the primary care. So I believe there's 4 streams in Ontario now that you can actually go into. And then to keep my skills up, I go to conferences once or twice a year. I take educational sessions, do online courses to increase my skill and knowledge in certain areas. That's what I basically do to keep my knowledge and skills up.